the last division of our alimentary canal before we get to the rectum and the anus is the large intestine. So the large intestine, remember, has a larger diameter, but it is actually shorter, and it has a smaller surface area compared to the small intestine. So its primary function is not the nutrient absorption. That is the function of the small intestine, but it has a couple of functions. So one, it houses symbiotic bacteria. And sometimes these are called enteric bacteria. And these digest the bacteria, digests food, and produces things that can be used by the body. So produces substances that can be absorbed through the small intestine. Okay, so you'll remember that when we look at the large intestine, it is connected to the ileum, the last part of the small intestine. So if we look at this diagram here, this is the small intestine right here. This is the ileocecal valve. Why is it called cecal? Because it is going to come into a blind-ended pouch. It's going to enter in near a blind-ended pouch, which is called your cecum. So your cecum is actually where you house symbiotic bacteria. Because it is a blind-ended pouch, then not all of the bacteria are going to be lost when you defecate. So it is a place where the symbiotic bacteria are housed. So in the cecum, we could say that it is a blind-ended pouch. Okay. This houses good bacteria. Hopefully, they're good for the most part. And it is connected to the appendix. You'll remember that the appendix is actually also part of your lymphatic system. It's part of the MALT, mucus-associated lymphatic tissue, and it serves an immune response. So if we look at the appendix, it is appended on to the cecum. So it's attached onto it. It is a finger-like projection. Appendicitis is when that gets infected. And if left untreated, sometimes the appendix can rupture. And what ends up in your peritoneum, your peritoneal cavity, is bad bacteria, which can lead to like a massive infection in your body cavity, which could eventually lead to death. So do you want to, if your appendix is inflamed and in risk of being bursting, right? You want to make sure you get to the hospital and they take it out before that happens. Okay, but the appendix is important because it fights off any bad bacteria that might be residing within the large intestine. So this is my cecum, and then we have the colon. And so from that cecum, we can talk about the ascending colon. So we can talk about our colon. Ascending is the first part. Then we have the transverse. And then we have the descending colon. So, oops, that's my email. So here we have the ascending is coming up. And the route that this takes is kind of important. Specifically, you sometimes do massages on babies' bellies, for example, to help them with if they have gastrointestinal issues, like if they have extra gas or they need to poop and they haven't, right? So massaging, you come up, and that is actually your right side, and then you come over, right? And then actually, would it be my right side? I'll have to think about that. Anyway, so this is my right side, comes over and then down. And so you can do like a circular massage of the abdomen to get that to move. You'll also notice that the large intestine looks weird. And that's because of like, it has these little pouches, which are sometimes called diverticuli. And sometimes you can get infections in that, and you can get diverticulitis. So that diverticulitis is infections that happen in the colon. Okay. The colon is also interesting because it produces a lot of mucus, and that actually aids in the movement of the feces out of the body. And it is also really important in water reabsorption so that your stool, your feces, is firm, right? So we can talk about the other functions, right? So we have, besides housing symbiotic bacteria, we can talk about the other functions, which would be water reabsorption. This is really important because you probably know that in some parts of the world where we might have unclean water supplies, you can get diarrhea like from bad bacteria in the water. You can get it and it will actually cause such bad diarrhea that you will dehydrate and die within days. So dehydration is a real problem when we get certain bacteria, bad bacteria, into the digestive system. So water reabsorption, right? Absorption of nutrients like a vitamin K. So these are nutrients produced by bacteria. So for example, vitamin K. Vitamin K is absolutely necessary for blood clotting. So when we are born, we do not have any symbiotic bacteria. We haven't been using our digestive tract. We have been getting our nutrients through the placenta. And so you might notice that the first feces that comes out looks weird. It's like dark and it's full of, it's like really tar-like substance. So the first time the baby poops, and that is called meconium, and it's a protective layer in the digestive tract. So the babies that come out do not have this symbiotic bacteria. So they might not have enough vitamin K for blood clotting if surgery is necessary. So this is why when babies come out, they give them a shot of vitamin K so that their blood will clot in case they need to perform an emergency surgery for whatever reason. Okay. So, and then the other function, ran out of room here, is the formation of feces, which contains bacteria, but also things like fiber. So it's undigestible material. So bacteria, it's brown because of a component of bile that makes it brown. So bacteria plus undigestible material where we weren't able to digest, like fiber, for example. Okay, so the last part of your large intestine goes into the rectum. So this is my rectum right here. And then we have the anal canal. So this has to actually pass through the pelvic floor, right? So the muscles that hold all of your pelvic organs in. So when we look at the rectum, it, remember, is stratified, like the esophagus. It's stratified epithelial tissue. And then when we look at the anal canal, there's actually an internal sphincter and an external sphincter. So let's look at this anal canal. So this is my internal sphincter right here, right? And then we have the external sphincter right here. So the internal sphincter is actually involuntary. So we can say internal sphincter. So this is what opens up when you feel like you have to have a bowel movement, right? And then you can decide whether or not you want to defecate. So the external sphincter is voluntary. Now you will keep that initially, that internal sphincter will open up and then it will relax. And then you're like, oh, I guess I don't have to go to the bathroom anymore. And then it will do it again, right? So it'll keep doing it until you eventually defecate. So you can't just like not poop or not defecate at all, because it's going to keep bothering you until you essentially just, it becomes inevitable that's going to happen. Okay. So when we look at the anal canal, notice that there's these blood vessels here. Sometimes those become inflamed and it can become painful. And those are the blood vessels that cause hemorrhoids. So this inflamed, painful, so you can't sit, for example, would be due to these blood vessels that are located right there next to the anal canal.